Premature ejaculation represents one of the most common sexual dysfunctions affecting men worldwide, characterized by the inability to delay ejaculation during sexual activity, resulting in distress for both partners. This condition, also known as early ejaculation, occurs when a man reaches climax and ejaculates sooner than he or his partner would prefer, typically within 1 to 3 minutes of sexual penetration. The prevalence of premature ejaculation varies significantly across different studies and populations, with estimates ranging from 15 to 30% of men experiencing this condition at some point in their lives. The complexity of premature ejaculation extends beyond its simple definition, encompassing psychological, physiological, and relational dimensions that interweave to create a multifaceted challenge for those affected. Understanding this condition requires examining its various classifications, underlying causes, and the profound impact it can have on individual well-being and intimate relationships. Medical professionals typically categorize premature ejaculation into two primary types: lifelong and acquired. Lifelong premature ejaculation, also termed primary premature ejaculation, begins with a man's first sexual experiences and persists throughout his life, while acquired premature ejaculation develops later in life after a period of normal sexual function. The etiology of premature ejaculation involves a complex interplay of biological, psychological, and behavioral factors that contribute to its development and maintenance. Neurobiological research has identified several physiological mechanisms that may predispose individuals to premature ejaculation, including variations in serotonin receptor sensitivity, genetic factors, and neurological pathways involved in ejaculatory control. Serotonin, a neurotransmitter crucial for mood regulation and sexual function, plays a particularly significant role in ejaculatory timing. Men with premature ejaculation often demonstrate altered serotonin levels or receptor sensitivity, which can affect the neural circuits responsible for ejaculatory control. Psychological factors contributing to premature ejaculation encompass anxiety, stress, depression, and early sexual experiences that may have conditioned rapid ejaculation patterns. Performance anxiety creates a particularly vicious cycle, where concern about premature ejaculation leads to increased anxiety during sexual activity, which paradoxically increases the likelihood of early ejaculation. This psychological component often becomes self-perpetuating, as repeated experiences of premature ejaculation reinforce anxiety and negative expectations about sexual performance. Additionally, relationship dynamics, communication patterns between partners, and cultural attitudes toward sexuality can significantly influence the development and persistence of premature ejaculation. The impact of premature ejaculation extends far beyond the bedroom, affecting various aspects of quality of life, self-esteem, and interpersonal relationships. Men experiencing this condition often report feelings of inadequacy, embarrassment, and frustration, which can lead to avoidance of sexual intimacy and strain in romantic relationships. Partners may also experience dissatisfaction, frustration, and feelings of rejection, creating a cycle of tension and communication breakdown that further exacerbates the problem. The psychological distress associated with premature ejaculation can contribute to broader mental health issues, including anxiety disorders, depression, and relationship dysfunction. Treatment approaches for premature ejaculation have evolved significantly over the past decades, offering hope and effective solutions for men struggling with this condition. Contemporary treatment strategies typically involve a multimodal approach that addresses both psychological and physiological aspects of the condition. Behavioral techniques, including the stop-start method and squeeze technique, help men develop greater awareness of their arousal patterns and learn to control ejaculatory timing through practice and mindfulness. These techniques require patience, practice, and often the cooperation of an understanding partner, but they can be highly effective when implemented consistently. Pharmacological interventions have also demonstrated significant efficacy in treating premature ejaculation. Selective serotonin reuptake inhibitors, commonly known as SSRIs, can delay ejaculation by increasing serotonin levels in the brain. While these medications were originally developed as antidepressants, their side effect of delayed ejaculation has been therapeutically leveraged to treat premature ejaculation. Topical anesthetics, applied to the penis before sexual activity, can reduce sensitivity and help delay ejaculation. Additionally, newer medications specifically designed for premature ejaculation treatment have shown promising results in clinical trials. Counseling and psychotherapy play crucial roles in comprehensive treatment approaches, particularly when psychological factors contribute significantly to the condition. Cognitive behavioral therapy helps individuals identify and modify thought patterns and behaviors that may perpetuate premature ejaculation. Sex therapy, often conducted with both partners, addresses relationship dynamics, communication issues, and sexual techniques that can improve overall sexual satisfaction and function. These therapeutic approaches recognize that premature ejaculation is not merely a mechanical problem, but involves complex psychological and relational factors that require attention and intervention. The importance of open communication between partners cannot be overstated in addressing premature ejaculation effectively. Many couples struggle with discussing sexual concerns openly, leading to misunderstandings, resentment, and further deterioration of sexual satisfaction. Creating a supportive environment where both partners can express their needs, concerns, and feelings without judgment is essential for successful treatment outcomes. This communication extends beyond discussing the problem itself to exploring alternative forms of intimacy and sexual expression that can maintain connection and satisfaction during the treatment process. Prevention strategies for premature ejaculation focus on developing healthy sexual attitudes, reducing performance anxiety, and maintaining overall physical and mental health. Regular exercise, stress management techniques, and maintaining healthy lifestyle habits can contribute to better sexual function. For young men beginning their sexual lives, education about normal sexual function and techniques for managing arousal can help prevent the development of premature ejaculation patterns. Additionally, addressing underlying mental health issues, such as anxiety or depression, can reduce the risk of developing sexual dysfunction. The prognosis for men with premature ejaculation is generally positive, with most individuals experiencing significant improvement through appropriate treatment. Success rates vary depending on the underlying causes, treatment approach, and individual factors, but many men achieve satisfactory ejaculatory control and improved sexual satisfaction. However, treatment often requires time, patience, and commitment from both partners, and some individuals may need ongoing management strategies to maintain improvement. Future research directions in premature ejaculation continue to explore novel therapeutic approaches, including new pharmacological agents, advanced behavioral techniques, and innovative technologies. Scientists are investigating the role of genetic factors in premature ejaculation susceptibility, which may lead to more personalized treatment approaches. Additionally, research into the neurobiological mechanisms underlying ejaculatory control continues to provide insights that may inform future treatment developments. In conclusion, premature ejaculation represents a complex but treatable condition that significantly impacts the lives of many men and their partners. Understanding its multifaceted nature, recognizing the interplay of biological and psychological factors, and acknowledging its broader impact on relationships and quality of life are essential for effective treatment. With appropriate intervention, most men with premature ejaculation can achieve satisfactory sexual function and improved overall well-being, emphasizing the importance of seeking professional help when needed.